Hi everyone, Dr. Remy from Pain Free and Fit. Today I'm here with my good friend Dan and we're going to be going over shoulder pressing, how to press overhead with or without weight, avoiding shoulder impingement. We call this one the anti-impingement shoulder press. Hope you enjoy. So, we're going to go over 5 points to look for to avoid impingement in the shoulder while pressing overhead. The first point is we want to make sure our shoulder blade is not rounded. Many people have a posturally rounded shoulder where the front of the shoulder contour is scooped out as opposed to flat. So we want to position our shoulder blade so the front of our shoulder has a flat contour. You can just hold your arm up and like this if we're going to press. Now, another big problem with people's alignment or posture of their shoulder blade is evident. This is a great example on Dan's shoulder posture. He naturally has what's called a tipped shoulder blade. His shoulder blade shape, the bottom of it, is actually held out away from his rib cage. So this is a common problem with a lot of people having to do with tight pecs and posture that's forward. We're going to correct that by having him tense the bottom of his shoulder blade forward as the top of his shoulder blade comes back. Can you just hit that correction? Beautiful. He's a natural at this, okay? He's just got to remember to do this while he's working out in the gym. So once we hold that tip forward, as we press overhead, we're going to keep that tip forward. We're going to avoid rounding the shoulder, and we're going to focus on the shoulder blade moving down and out. So the tip is going to move down and then out in a circle. Go ahead. Pressing up overhead. There you go. And that allows the shoulder blade to move out and clear the area for the upper arm so it doesn't impinge against the underside of the acromion or the top of the shoulder blade and collarbone where they come together, come down. So that's 3 points having to do with shoulder blade. Again, we're going to be flat in front. We're going to make sure that the tip is forward, and we're going to make sure that we rotate out. Go ahead, try it again. Excellent. Now, for some people, the rotating out really needs to be emphasized, and those are people with a natural downward shoulder posture. You're going to look at some people, including yourself. You could have your training partner or friend look. The inside edge of the shoulder blade should be parallel with the spine. And in people with a low shoulder on one side, many times that's the side where you're going to get impingement and tendonitis in the shoulder, especially with pressing overhead. As opposed to having a parallel border, the shoulder blade's going to have an outwards tilt because the whole thing is held down. If that's your case, you've got to make sure that you're really emphasizing a lot of motion of moving out and up with the tip. And I want you to do that. Keep the tip forward. Just really emphasize out and up. There you go. That's really accentuating the motion of the shoulder blade. That's allowing more of a clearance at the top of the humeral head where the top of the arm bone meets the shoulder joint. And then finally what we're going to do is we're going to think about the upper arm. The other 2 points of the anti-impingement press is his upper arm. Many people have what's known as an anterior or forward slip of their upper arm in the shoulder socket, as well as an upward slip. Again, this is due to a muscle imbalance and altered force couples, which is the normal balance between the various muscles of the shoulder, helping to hold the shoulder in the right spot as it's moving. So what we're going to do is we're just going to use a little bit of movement, maybe an 1/8 to a 1/16 of an inch, of the upper arm moving back and down, and we're going to emphasize that as he presses overhead. Let's try that. Back and down. There you go. You also notice he's not shrugging up as he's pressing. That's a big common mistake with a lot of people who have upper trap dominance and weaker lower traps. So if we put it all together, we'll give him a light bell. And you'll also notice a very simple thing to help with impingement is if you're constantly pressing with a bar that allows you to use a pronated grip like this, it's going to force the upper arm into internal rotation, meaning moving this way, which will increase impingement. If we hold bells or a parallel grip on a shoulder press machine, that naturally externally rotates the upper arm, and that also helps to decrease impingement. So let's put the 5 points together. Number 1, we make sure that the front of our shoulder is flat. Number 2, we keep the tip forward. Number 3, we're going to keep the arm back forward, down in the socket, and lastly, as we maintain all of that, as he presses up, he's going to emphasize the shoulder moving down and out. Go ahead, shoulder blade, down and out. Excellent. Notice he's square across the top of his shoulders. He's not shrugging. Come on down again. Do a few more reps. Tip is forward. Shoulder blade is slightly in, so we're flat here, not rounded. Arm bone is back and down in the socket. I can feel that with my fingers pressing up. If you have a training partner, they can monitor with their hands if you're doing this correctly. It takes some practice, but you can definitely feel it. If he's doing it wrong, I'll feel that upper arm move forward in his shoulder. There'll be a hardness where his anterior delta is on the front of his shoulder. Press up one more time. Down and out. And relax. And there you go. The anti-impingement shoulder press. Practice that. You're going to get great shoulder workouts in without your injuries. Enjoy.